Amanda Hansen back here at the Action News 5 digital desk. And we've been talking about mental health here this morning. And so have you heard about the Living Well Network? It is a great service that is offered by Methodist Le Bonheur Healthcare. And joining us now to talk more about it is Allison White, the supervisor for the Living Well Network. Glad to have you back here on the digital desk. How you doing?
Great. Thanks, Amanda.
So for people that maybe aren't familiar with the Living Well Network, can you talk about the work y'all do?
Sure. So we are a free community service, and we offer assessment and referral to behavioral health services. So anyone in the community can call us, and we will assess their need, and we'll match them with the right provider. So Amanda, think of us as a concierge service almost. So we're going to help connect you to the right person. And we also offer free mental health education to anyone in the community, churches, schools, civic groups, professional organizations. So we do a lot here.
Yeah, it sounds like it. I know y'all stay busy. Can you tell us about this upcoming mental health breakfast that y'all have down the line?
Sure. So our 9th annual mental health breakfast is Tuesday, May the 2nd. It's over at the Hilton in East Memphis. And we are really excited to have our keynote speaker this year, Joe Pantoliano. He is an Emmy Award-winning actor. You might remember him from The Sopranos, which was a long-running, great TV show. He's also been in The Matrix and some other TV and movie. His list goes on. And he is going to be talking about his battle with chronic depression. And we're also having a breakout session after our keynote speaker. And we have a local therapist who is going to be talking about all things men's mental health.
And, I do want to talk, with men, I think it's so important to be able to focus on their mental health. I think sometimes, a lot of times, men avoid that. They don't want to seem like they're having a hard time or they're struggling. Can we talk about some of the misconceptions when it comes to men and mental health?
So I think one of the biggest myths that especially men have about their own mental health is that, well, men don't get sad. We don't cry. Well, we know that that's not true. We know men suffer from depression and mental health issues just as much as women do. They are less likely to seek treatment. And I think the reason is because of these, social norms that, and these myths that we have that men are supposed to be the strong ones, right? But if you look at statistics for suicide, for example, men make up 78% of all suicides in this country. So we know they're struggling, and we want them to be able to change that narrative and say it's okay not to be okay. We want them to seek out treatment when they need it.
And what are some signs maybe people could look out for to know if someone's struggling?
Right. So I think a lot of times with men, you might see more irritability for a certain period of time. You might see more decrease in their hobbies or activities they used to enjoy. And I think they're less like you're more likely to see that as opposed to maybe the sadness, maybe they're not getting up and not taking care of their hygiene routines, although you can see that. I think though, we're looking out for other things too. The change in patterns and the change in behavior and the irritability more so.
And how can people contact the Living Well Network if they're saying, hey, I think I could benefit from the resources that they offer? How can they get in touch with y'all?
So we have a website. It's www.thelivingwellnetwork.org. We have lots of information on there. We also are here Monday through Friday, 8 to 4:30, and you can call us at 901-762-8558.
And again, that 9th annual mental health breakfast is coming up May 2nd. It's a big deal for you guys. I know the proceeds go to benefit the work that y'all do and to continue that work of offering that free mental health resources to people in the community. So, Allison, I appreciate having you taking the time to join us today, and you have a good rest of the morning, all right?
Great. Thanks so much.